So reducing the dose of a TKI is a really useful tactic for a number of people on the drugs for chronic myeloid leukemia. There are several instances where you might want to reduce the dose. One of them could be that you're actually aiming for treatment-free remission, being off the drug, but we'll cover that in a different video a little bit later. But the other reason you might want to dose reduce is that actually the side effects that you're getting are affecting quality of life, or you actually want to make yourself feel better. Either they're side effects that mean you're mandated to reduce the dose, such as maybe your liver function, or there's a pleural effusion that's been developed, and actually we're very familiar with reducing the dose. We've got specific side effects. But if you've got side effects that are just making you feel generally not so well, more fatigued or more nauseous, that mean you don't have to reduce the dose, actually, can you feel a bit better by reducing the dose? And whether or not you can reduce the dose is often dictated by how well you're responding to the drug. So when the clinician in the clinic is thinking about the dose of the drug you're on, they're weighing up the response to that drug, and they're also weighing up the side effects you're getting. And I'm trying to use the general principle of patients should be on the least amount of drug, so they get the least amount of side effects, that is giving the best response that you need to get for that patient. So, and it is often trial and error trying to find the right dose for a different patient. And reducing the dose is often used as an alternative to maybe switching drug. There's also increasing evidence that reduced doses of certain drugs can work just as well in the long run as the full doses. We know a little bit more about ponatinib now, and if you start on higher doses of ponatinib and get to a reasonable response, you can reduce the dose back down to a much more tolerable level. The same with bosutinib as well. Actually, they've shown that long-term reducing the dose can reduce the side effects, and actually, as long as you do get a reasonable response, that you don't lose that response over time. So it's a perfectly safe thing to do if, again, you need to be adequately monitoring your BCR able to make sure that's safe. And I would always recommend to people, if they're reducing the dose, maybe think about doing slightly more frequent BCR able testing, just so you've got that reassurance that you're getting the same efficacy.